Hi everyone, News Channel 5's Chris Conti here. We are talking about signing up for healthcare through healthcare.gov and getting health insurance. My guests tonight are Mary Moore and Sharon Barker.
Yes.
Missed that R.
Okay.
We do have a lot of people who are calling in. We will get to some calls in a minute here. The number is 615-737-PLUS, 615-737-PLUS. So the deadline to get signed up for healthcare through healthcare.gov is next week on the 15th.
If you want it effective
January 1. Okay. Which most
people do.
Yeah.
But
and if you don't want, and we have some important dates up here on the screen here. So January 1st, 2017 coverage starts for those who enroll or change by the 15th. So if you can get your applications in by the 15th, then you will have coverage starting 12 or 1/1/17.
That's what we recommend.
Yes.
You get the most out of your plan because you have a whole year to reach your deductible.
Right.
And also for those folks where maybe they had Blue Cross or United and their plan is going to be discontinued on December 31st, they need to choose a new plan by December 15th for their new plan to start January 1st. So they don't have a gap in coverage.
Right.
Let's see if we can get to some of these phone calls. We have Jennifer on line 1. Jennifer, can you hear us?
Yes, I can hear you.
Where are you calling from?
I'm calling from Smyrna, Tennessee.
From Smyrna, okay. And do you have health insurance right now?
I do have health insurance through my husband's employer.
Through your husband's employer. Okay. And go ahead. What's going on?
Well, my concern is with the Affordable Health Care Act is that it is very important for us to get people covered. But there's a lot of laws that are written into the Affordable Care Act as far as preventative screenings. I just recently got a diagnosis of ovarian cancer.
Oh, sorry to hear that.
Stage 3C. And it turns out that I'm also BRCA positive. And I had to have a very expensive genetic test done. And when I went through the process of getting my daughter screened as well, because it's genetic, I was speaking with my insurance company, and they were telling me how closely they were watching this election, because some of these preventative screenings that are expensive, like my daughter's was going to be, can be taken away from us.
And what would that mean to you?
Well, it's detrimental. I also, when I'm done with this chemotherapy, I am going to have a prophylactic mastectomy done because I'm BRCA1 positive, and breast cancer was really what I was waiting on. I never saw ovarian coming.
Yeah.
But, these are laws that are very important. Having my daughter screened, and then thought of that, having that taken away from many women, birth control, things like that. There's a lot that's written into this Health Care Act that, has a lot to do with coverage, but it also has to do a lot with these tests that save our lives.
Yeah.
They can be expensive.
It's true.
I don't want to see those things go away for the American people. I don't know if the American people really understand that when this act goes, not just your children not being covered, it's going to mean blood pressure screenings, cancer screenings, mammograms, birth control. There's so much that's wrapped up into the Affordable Care Act. It goes beyond our coverage.
Yeah.
People have got to know about this. We've got to start telling them. The American people have to know that a lot of stuff is going to get taken away from them if this goes.
Yeah. Well,
it's terrifying to me.
Yeah. Well, thank you for calling it, and good luck with everything, Jennifer.
Okay, thank you.
Yeah.
Jennifer, thank you so much for sharing your story. And those are exactly the kinds of stories that we hear and that are so important for others to hear, because I think it is about informing people what's at stake and the benefits that can be gained through coverage under the Affordable Care Act. So,
and not just coverage. There, we were talking about some of the, intricacies of this that kind of came in a couple of years ago in terms of getting people covered and pre-existing conditions. But there's a lot of facets of this that affect a lot of people in various different ways. And you can understand why there's so much, trepidation around it right now because of the uncertainty. And when you hear stories like that, it's, you understand why people are nervous.
Absolutely. She brings out such a good point. Preventive benefits are huge. Your mammograms, your colonoscopies, the screenings like her daughter, those are huge. People don't really realize how beneficial that is to have. And so I wish we could put Jennifer's call on a robocall and send it out all over
Jennifer, we would love it if you would like to share your your story, contact
Yes.
us through our 844 number, which will be showing on the program in a minute.
Please.
And we would love to share your story far and wide. We really appreciate that.
Let's go to Fred now. Fred, can you hear us?
Yes,
And where are you calling from?
Smyrna.
From Smyrna also, okay. And I hear that you are one of these 280,000 people who are living in the gap who can't get coverage right now?
Yes.
And so
Yeah.
what's going on?
Well, I live on very little money. I haven't worked for several years, and now I'm having severe problems with my memory loss. And the situation is, I can't get a doctor to even help me with it because I can't pay them in full.
Right.
For the do the tests they do, I have to pay them in full, and I can't do it.
And so have you applied for, have you tried for TennCare?
I've tried for TennCare. I've applied about. It's been refused and refused and refused and refused.
Yeah, and
10 times.
And I'm assuming that you don't
The
make,
only reason is because I'm a man who doesn't have any children
yeah,
responsible.
and you
for.
don't, and I'm assuming you don't make enough, you don't make enough money to
I do not make enough, no.
afford
The tax credits.
tax credits and the or healthcare.gov. So, I mean, we talked about this extensively a couple weeks ago in a special report we did, but it's tough because there are a lot of people who are stuck in this gap, and people say, well, what can I do? What can I do? And a lot of times the answer is nothing. Unfortunately, I mean, there are groups out there who are trying to help these people,
right.
but this is what lawmakers at the Capitol are working on right now, is trying to close this gap because there are so many other people like him who are stuck in it.
Right.
And you start to realize, I mean, for these people who can get this insurance, I think it speaks to how critically important it is for these folks that can
Right.
get it, because if not, they would be in this same situation possibly.
Absolutely. Health assist, should we?
Yes, we do have our Health Assist number, which we'll be putting up in a moment, that you can call into. Yes, there it is. And it's for those who are in that gap that are ineligible for TennCare because they don't fit into a category. And that's what Fred was referring to when he said that he doesn't have any minor children that he's taking care of. But they make too little to qualify for financial assistance on the marketplace. So they may be able to help with finding a doctor or a sliding scale clinic for the uninsured.
And
but
those numbers, you want to just read them in case? What are they? What Health Assist? What does that do for people, and why should they call it?
Yeah, so the Health Assist number that I was just speaking about is 615-313-9972, and that's for those who are ineligible for TennCare or the marketplace. And then the connector is 844-644-5443, and if you call that number, you'll someone will ask you just a few questions to see what you might be eligible for, a little screening, and then make you an appointment with a navigator or a certified application counselor near you for in-person assistance.
Okay, let's see if we can take another call or two here. I believe we have Mike on line 1. Mike, can you hear us?
Yes, sir. How are you guys doing? Okay.
Great, thank you for calling. Where are you calling from tonight?
I am calling from Waverly, Tennessee.
Waverly, Tennessee, out there by Only, right?
Yes, sir.
Okay.
Hey, I have a question.
Yeah.
Two ladies. I work through my church with the homeless in Nashville every Saturday, and we do a meal for them and everything. And my question: are the homeless eligible for this Affordable Care Act open enrollment? Can I send them somewhere maybe to get some health? The facilities, because we see so many of them that doesn't have anything, and sometimes they ask us, do we know places, and I just want to know if there's a place I might can send them to in Nashville, because I live down here in Waverly, and I'm not familiar with everything in Nashville, and I'm just trying to make a difference with God to help these people, and I'll hang up, and thanks for your time.
Okay, so
Mike.
I mean, I know the short answer is yes, but I'm assuming, but if someone's homeless, they're likely not going to be able to afford coverage through healthcare.gov. So, in that aspect,
they possibly will be in the gap.
Right. Or, maybe the answer he is looking for, there are, if someone is not maybe looking for coverage, but just needs to be seen, there are some free clinics, or faith-based clinics in Nashville that people can turn to.
Yeah, and that Health Assist number is a great resource for them
homeless.
to call and try to get connected to a safety net clinic.
Right.
where they can be seen. But I mean, being homeless doesn't make you ineligible
No,
for the marketplace.
absolutely.
But one would assume
Yeah.
that possibly that they wouldn't be able to
If
afford.
there's no income.
Yeah. Yeah.
Exactly.
I believe we have Phyllis on line 1. Phyllis, can you hear me?
Yes, sir.
Okay, and where are you calling from, Phyllis?
I'm calling from Murfreesboro, Tennessee.
Okay, and do you currently have health care?
No, I don't have health care.
Okay.
I had a full-time job with insurance,
Okay.
but I had to quit my job to take care of my 83-year-old mother. So now I'm working a seasonal job, and it's over
Okay.
for Christmas. So, and I had called the marketplace, and they told me I would have to pay like $700 for insurance, and I don't even really have a job
Yeah.
because we're getting ready to end for Christmas. So, and I don't know why come I'm not eligible for something.
So what options are out there for Phyllis?
So it sounds like, and that can be a very frustrating experience.
Very.
We hear this a lot. Someone calls the marketplace, and maybe they have little income, or they don't have a job right now, and then they're quoted a really high price for insurance, and it can be frustrating because you're thinking, I can't afford $700 a month. You know, I don't have any income right now. And what that is that somebody who we refer to as in the gap that we were talking
Right.
about earlier. So for a single person, in order to qualify for the financial assistance through the marketplace, their income has to be at least at the poverty line, which for a single person is about $12,000 a year. So if it's below that, there's not a tax credit that will help you pay for your insurance through the
Right.
marketplace, but you may not fit into a 10-care category
Right.
either if you're a single adult without minor children.
Children.
So that
Possibly
is the
fall in the
coverage
gap.
gap. But I would encourage Phyllis to still call a navigator
Absolutely.
and talk about her situation, because you know she has a part-time job right now. It sounds like
So
you
her
know,
expected income for 2017 may
Maybe they could work.
meet the
Right.
guidelines for it.
Right. And what
Tax credit.
and what are some of the guidelines in terms of salary and what, you know?
Well, like Mary was saying, for a single person, household of one, you need to be at least 100% or above the federal poverty level limit, which for one adult is like roughly 12,000.
Okay. And then how much, say you're just a working adult, single, and you go to the healthcare.gov to sign up, how much will your plan be a month? Well, I know it depends, but what's in that, you know? What
It
can
does,
you,
but just for, I've signed up people that were right at 12,000, and there were plans that came up at
12,000,
a
that
year.
they were making $12,000 a year.
A year,
Okay.
one person
One
household.
person.
And there were plans that came up at 0, then 24, then 54, then they go up to 140, and then a Humana maybe, you know, like 160 or something. So there are plans as cheap as a 0 premium a month with a household size of 1.
So do you end up does anyone pay anything, like how, so they don't end up paying anything?
Well, they won't. Yeah, the plan is not free.
Right.
It's just that because of the tax
Tax
credit that
credits,
they
they
may
end up-
be eligible for, that amount is sent to the insurance company, and it leaves them with
And it
0 to pay.
balances out.
Right, it balances it out.
Right, okay. We are going to take a quick break. We want to remind folks to call in 615-737-PLUS, 615-737-PLUS, and we will continue our coverage about healthcare coming up after the break.